how our organization, how our ambulatory care practice built a dashboard, selected the contents of that dashboard to guide us on our magnet journey, where we found the benchmarks. Keep in mind that during the early days of this journey, there was not a lot of information on ambulatory benchmarks. There's a lot more out there now, but it's still growing and it's still an area that needs development. And then for the things that there were not benchmarks, we needed to develop internal metrics for monitoring and tracking that, and some of our success with that, as well as where do we get the data from that we're going to use to compare to our benchmarks. And then I want to really highlight how we've used the dashboards, not just for our magnet process or our progress towards magnet, but how it's impacted care. I know many of y'all have used dashboards in your organization for a lot of things. Many times they're financially driven. But to truly track quality and the ability to share that information across the organization has really impacted care, and I think it's a valuable tool. So just a little bit about our organization, Emory Healthcare. The Emory Clinic makes up a portion of our Emory Physician Group practice. So we're in Atlanta, Georgia, primarily, but we have a presence throughout the state. The history of Emory Healthcare goes back to, or the Emory Clinic goes back to 1953, where they established basically a group of individual physician practices for the faculty at the Emory School of Medicine. That program has evolved over the decades, and as most recently as 2010 really congealed into a solid organization and started moving towards standardization of practice instead of a bunch of individual practices doing their own thing, to a model where everybody's trying to move in the same direction and share that information. You can see, like I said, our diverse spread across the state of Georgia and the growth of our organization. Building on that, so part of Emory University, the Emory Woodruff Health Science Center is our overarching governing structure, which includes the School of Nursing, the School of Medicine, Emory Healthcare. So our Emory Healthcare environment, we have about 5.4 million outpatient visits. So that's kind of what we're touching on in the ambulatory care environment. We've grown to where we have around 1,000 RNs, about 300 LPNs, and about 600 certified medical assistants in the ambulatory care areas. Again, the Emory Clinic is a portion of that. We also have non-faculty Emory employed physicians through our Emory Specialty Associates, but our magnet designation was focused on the Emory Clinic, which is the faculty-based, and included our ambulatory surgery centers and our oncology and outpatient infusion centers. But we are, like I said, a multi-specialty program. Based off of our School of Medicine divisions, we've got about 27 departments, which involves into about 70 medical specialties. So a very wide-arching, and we have about 250 locations across the state of Georgia where we provide services. We're proud to be a part of the Emory University process and the Woodruff Health Sciences Center. Emory is a top 20 in NIH funding nationally. We have had some of the best clinical outcomes on our inpatients with our COVID care. We have a highly rated school. Our School of Nursing is very highly rated, and as well as other schools in the university. And then as part of Emory Healthcare, we've got 4 magnet designated hospitals out of 11. And then our ambulatory practice, the Emory Clinic, recently received magnet designation in 2022 and one of the first organizations to achieve that as a standalone ambulatory practice.